This is the Olikoye Ransom Kuti Children Emergency Center, which is the aspect of the emergency room, as I said, primarily responsible for children. So we find children coming in with medical, surgical, and sometimes coming in with other needs that may not entirely fall within those main need. The center was named after one of our most distinguished teachers and mentor in the practice of pediatrics, who is the late Professor Olikoye Ransom Kuti.
This particular project is about renovating the accident and emergency ward of the Children's Emergency, LUTH. The idea is a lot of times we focus on equipment and the staff, but we know that there's also the psychological component to help, and research has shown that the environment makes a difference. Colors make a difference, art makes the difference to healing. So we are trying to incorporate an environment or create an environment that actually promotes healing.
We see patients in the emergency room, and we have to see patients in environment which is hot, in an environment which is uncomfortable. The patients have to endure that discomfort. They have to then endure the heat, the beds that are hard, the dinginess of the place, you know. And sometimes this can create some level of crankiness, some level of impatience on both sides. And some of the patients actually want to go home early because they don't want to stay in this environment. Mothers are sitting on chairs when their children are on admission, and that's not ideal for any mother.
The environment is the only place I can say that there is error, because we, like my daughter, will stay in passage instead of in a ward, like having our own bed. We managed a stretcher. So, and secondly, the environment and the inside of the place, some walls are not neat, like in a place you're supposed to keep little children. So they like to be in a lively environment, like a place you have a flash a television with cartoons, so they can be watching it and without feeling that they are not at home. If the management will come up with lively things in this ward, like changing the paints, making it more colorful, like a place where children should be, I will be more than happy.
And I was recently opportune to come back to LUTH, you know, just to visit, and I was actually quite appalled at the state of things. The Children's Emergency in particular is nothing like I remember. It used to be quite organized, it used to be in a good state, you know, but I came here and I saw like the walls and I saw the way the things were, and honestly I don't believe that it's an environment that is conducive enough to encourage recovery in children.
I think the Nubia team have done a fantastic job. I think foremost is the fact that they actually thought about this idea. It's soothing, it's beautiful, it's calming, and it has this emotional appeal. It makes you feel comfortable that the doctors, the nurses, the attendants have got you covered. It gives you the confidence that whatever you have come in here with, they will solve the problem and you go home healthy. We want to encourage parents, families, citizens of Nigeria to actually try and co-sponsor events like this, initiatives like this, because our children are our future for tomorrow. They're all that matter.
We got approached by the NGO, Luvia Health Organization, and they had this fantastic platform, you know, in terms of creating a healing environment, you know, in a hospital called LUTH, you know, and we thought it was an interesting thing. It's also part of what we have been trying to do in terms of partnering with stakeholders in the health sector in order to achieve improvement of maternity and pediatric health care. So what we've done is we've added value here. We want people to come and feel comfortable within that hospital environment. We want them to feel loved. We want them to feel like they're going to be cared for.
It's really a dream come true, and it's for me also a reminder that there are good people in both the government and private sector who are working day and night to ensure that the healthcare indices of this country are significantly improved upon. And for those people, I have nothing but utmost respect and utmost thanks as well on a day such as this.
There's a beautiful lawn right outside the emergency center. We're hoping to maybe convert that into a play area for the children as they start to feel better, to go outside, and hopefully it would also motivate them to get out and start, moving about, which obviously helps healing. Go outside and play, get some fresh air, and go back in. So we're going to have a meeting with LUTH management, particularly pediatric department, to find out where the gaps are. I know that part of the gaps that have been identified is the plumbing, which comes to water, sanitation, and hygiene. And that's something that we intend to look into next year. And we'll just keep seeing where the gaps are in child healthcare and keep plugging them as best as we can.